Thank you, Mr. President. As you can see from the hopeful signs in Italy and Spain, where we see finally new cases and deaths declining, it's giving us hope of what our future could be. We wanted to give you an update on where all of the states were. We're looking at this as states normalized per 100,000 citizens. It looks very similar to last week. We wanted to update you. We've been covering throughout the week the states that were moving on this map. You can see very clearly where New York is as a state, although this is very much still centered in the New York metro area. New Jersey is the orange line. The green line is Louisiana. That's followed by Massachusetts, and then Connecticut and Michigan are together in those lines towards the bottom. And then, of course, Washington, D.C. is now visible on this map, which was not visible before. And the yellow line towards the bottom is Washington State. Next slide, please. So this just summarizes all of the states we're tracking very closely at the county level. So we're tracing and tracking not only the epidemic at the state level, but understanding what's happening in county by county with new cases and, of course, also the deaths. We're also triangulating that with all of the laboratory data. And just to tell you how we're kind of doing that, for New York, which you can see at the top, their serology is now about 36% positive. They were in the 40s. So day over day, their percent positive is finally starting to decline. New Jersey's is increasing, however. They're now up to 42% of the specimens that come to the laboratory are positive. Louisiana, 25%, Massachusetts, 20%, Connecticut and Michigan, 20%, District of Columbia, 15%, Washington, 8%, and then Illinois, Colorado are at about 16%. Pennsylvania, which is also new to the graphic, is at about 12%. Next slide, please. So if we could go back one, I'm sorry, if we could go back one slide, one more. All of the states here, those are 38 of the states. 38 of our states have less than 50 cases per 100,000. They are testing. Their laboratory results are consistent with that. Their seropositivity rate for their laboratories are less than 5%. So this is how we're tracking and triangulating both case reporting, mortality or fatalities, and also triangulating that with the laboratory. The New York metro area, New Jersey, Louisiana, and a series, and Washington State have all tested at a rate greater than Italy and Spain. I know many of you are tracking that. Remember, many of us, we pushed out a lot of those assays at the beginning over the last 2 to 3 weeks, and I want to just thank Admiral Giroir and HHS, who's been working very closely to make sure that the states that were having an outbreak had access to all of their assays. Next slide, please. And then next one. So just to give you an idea of how we're looking at this, we look at cases every day. I want to just thank my data team. They spend all evening compiling data. I get it about 2 o'clock in the morning. And it looks at all of these metro areas by their granular counties, so we can see the counties that have new cases. That also helps us identify the hospitals and understand what hospitals will need ventilators or PPE. So this is the Detroit area. It's Oakland and Detroit, Wayne County. Next slide. We also track mortality. It gives us insight into how many clients are in the ICU and need care. We want to make sure that we're meeting the needs both on cases and really appreciating the frontline healthcare workers that are really saving many people's lives. Next slide. This just gives you an idea from New Orleans. We are now also tracking St. John the Baptist Parish also, but this was New Orleans and Jefferson County, and really tracking those on a case-by-case basis to look for changes over time. And next slide is their mortality. And you can see it's starting to stabilize. So this is how we've been tracking and tracing the epidemic as it moves through states and counties and communities. But as we started, we just wanted to note again, we do see hopeful signs in Spain and Italy. They have completed nearly 4 weeks of mitigation with people really doing social distancing, staying at home, ensuring they were washing their hands. If they have to go out to the grocery store, they're extraordinarily careful. They send one person from the family. And so we can really see that beginning to work, and we're very hopeful that over the next week, although we'll see rising number of cases of people who lose their lives to this illness, we're also hopeful to see a stabilization of cases across these large metro areas where the outbreak began several weeks ago. So thank you for your attention.
Thank you very much. Sir, what I thought I would do is update on the air bridge first, and then follow up on Dr. Bricks and how we're geographically aligning the supply chain. So the air bridge, we had 3 additional flights come in today, bringing 1 million gowns, 2.8 million N95 masks, 2.8 million surgical masks, 11.8 million gloves, 18.6 thousand gowns on 3 flights. And that material will be pushed out across the nation, delivered to hospitals, nursing homes across the country. Dr. Bricks went through the geography, and so over the last few days, I've been aligning the supply chain to those areas, and then reaching down into those areas and extracting data from those areas on PPE burn rates. So, for example, I spent the weekend talking to the Chief Operating Officer of Detroit, Hakeem Berry, for example, then talked to the leadership at Detroit Medical Center, Audrey Gregory, talked to the health officer in Oakland County, Michigan, and then also with the Chicago health officer, Dr. Allison Arwey. So reaching down to a level to understand their needs. So we're geographically aligning the supply chain, right? So you can see Dr. Bricks went through these counties, and we're getting down to the county level. And then aligning it by priorities of point of care. Public hospitals first, VA hospitals, private hospitals, nursing homes, first responders, acute care. So over the coming days, we will be making a push to the geographic areas that Dr. Bricks mentioned, increasing the volume through the supply chain to those areas to give them weeks, not just days worth of supply. Primarily using our industry partners that we are directing, Cardinal, McKesson, Medline, Owen Minor, Henry Schein, Concordance Healthcare, directing them to put product to the hospital door, the nursing home door, the first responders, directly to them. We're also working to push out millions of doses of hydroxychloroquine, right? We are working the distribution there to push the same thing to the same impacted areas, working it to get in the hospitals and to every pharmacy. And so my team is back there right now, working the arrangements to make that to the hospital front door and primarily to the local pharmacies, so doctor can write those prescriptions and you can get it prior to having to go to a hospital.
Thank you, Mr. President, Mr. Vice President. My last appearance here, I mentioned that the President had given the Department of Veterans Affairs very specific instructions to be as aggressive as possible in response to the virus crisis, and not only to protect veterans, but also to help the American people. As many of you know, we have 3 primary missions at VA. One is to support veterans' health, the other is to provide veterans with benefits, and the third is memorial services. But we have a 4th mission, and that is to support the nation in times of national emergency, both in war and in peace. We provide a bridge from the federal government to the states and localities during these emergencies. As a result of that, I have ordered our veterans hospitals to begin preparing more than 1,500 beds to make them available both at the ICU and the acute care level to the states and localities across the country. As a result of that, we have opened up approximately 100 beds in the metropolitan New York area, in Brooklyn, and in Manhattan, and East Orange, New Jersey. We will be informing the governor of Louisiana, John Bel Edwards, tomorrow that we will give him access to our VA Medical Center in Shreveport, Louisiana, to come to the aid of the people of the Pelican State. I've also given instructions to initiate the 4th mission in Michigan. We will be providing the people of Michigan access to hospital beds in both Ann Arbor and in Detroit. We've also provided a pharmaceutical trailer to be used by the governor of Michigan at Cobo Hall to support the citizens of Michigan who will be coming into that facility for medical care. We have also informed the Commonwealth of Massachusetts that we will be helping them in their efforts to protect their most vulnerable citizens in 2 of their nursing homes. So in accord with the President's instructions, the 400,000 men and women of the Department of Veterans Affairs are in this fight. We are in the fight not only for the 9.5 million veterans who are part of our service, but we are in the fight for the people of the United States.
Thank you.
I want to ask you about the air gap flights, sir. There were the 2 flights that came through. The 3 flights, where did they come from, sir?
They came from Asia.
Asia, okay. And then you were mentioning all these supplies being dropped off, the masks, the gowns, the hydrochloroquine. How are you guys making sure that there's not a run on these products? You know, you drop them off at Hospital A and that people just don't rush and go grab every mask, gown. And then a question for you, sir, after that.
And so it's going to the loading dock, and there's an invoice. And so those people that are responsible for that loading dock and that invoice, they're going to make sure that there's not going to be a run on the back.
Run on any of these. Okay. Thank you, sir. I appreciate that.
I was hoping to ask Dr. Burks a question. The president just said that, based on the most recent data, that you've seen some change in the projection. I'm wondering if you could, you obviously have a week's more worth of data since the sort of 100,000 to 240,000 potential death figures that you gave us last week. So I'm wondering, with all the caveats that this is sort of based on continuing social distancing and that we might see, you know, if one city pops, things could change dramatically. What are the sort of range that you're now looking at in terms of total death impact?
I think the most important thing right now is when we were talking about why we are hopeful. We're hopeful because last time I was here, I wasn't able to really tell you that Italy and Spain were coming across their apex and coming down the other side. And I think, to me, that's extraordinarily hopeful. They just completed 4 weeks of really strong mitigation. And I think that's our word to the American people, is we can look like that. 2 other countries look like that now. 2 other countries with a very similar experience to our experience, with higher case numbers and higher mortality. So that's what the promise is. The promise is, if we do this, we could potentially be better. Now, Dr. Fauci and I today got another update from another independent modeler, and the numbers came in close to that 100,000 number again. But we believe, Dr. Fauci and I, that if every American follows the guidelines, 6 feet, washing hands, not social gathering, that will have an even greater impact. And the other side of the equation certainly is our remarkable healthcare providers, our respiratory therapists, our laboratory technicians, our nurses and doctors. They're saving lives every day. And so that changes the number too.
Correct. FEMA's working on a plan to be able to move ventilators. So, for example, the DoD gave another 500 ventilators. They're on the move, being staged at Fort Dix to be able to rapidly deploy them to locations. And to include, you heard the president mention states giving to states, things like that. So there's the ventilators that aren't in use that conceivably we could rapidly move as well.
Right.
The 15-minute test has really been a breakthrough. I reflected on the progress that they've made in Detroit to put first responders back on duty with the Abbott Laboratories test. Abbott Laboratories started last Tuesday producing about 50,000 tests a day. And there's, I'm informed that there are about 18,000 of these machines already all across the country. I mean, they're actually the same machines that you use to get a strep test quickly when you go to the doctor. But now Abbott is surging these new 15-minute coronavirus tests out to healthcare professionals and healthcare facilities around the country. In addition, as the president said, FEMA has purchased 1,200 of these devices. We're distributing them to all 50 states and the Indian healthcare system, and then we'll be distributing the tests. Dr. Burks, is there anything to add further on that? Okay, further.
They've already received these tests?
Let me ask Admiral Polovchik about the 1,200 devices.
I didn't hear the question.
Have they received the 1,200, or what's the timetable?
I believe they're on the shelf at Abbott, a good majority of them.
Tuesday they go out.
Right, yes, sir. So I don't have the exact numbers. I think there is some manufacturing in there, but
They go out
large
Tuesday.
balance of them are on the shelf.
Mr. President, if we're going into this most difficult of times, how can the American people sort of emotionally prepare for that? And while the president is talking and is eager to see the country reopen, how do we balance the mitigating factors that still need to take place before we get to
Okay, so part of the answer to your question, I think, relates to two other questions I heard, and I think it came from the back about how can you, on the one hand, have said yesterday that this is really going to be a bad week at the same time that we're talking about the light at the end of the tunnel. It seems to be inherently contradictory, but it really isn't. And it has to do with what we explained before about the lag in when you look at the indications that Dr. Birx and the president was talking about, where you see a flattening out of cases, and you don't see the realization of what that means until 2 weeks later. So right now, we're seeing, as we all said correctly, that this is probably going to be a really bad week. That is a reflection of what happened 2.5 weeks ago. So if we start seeing now a flattening or a stabilization of cases, what you're hearing about potential light at the end of the tunnel doesn't take away from the fact that tomorrow, the next day, it's going to look really bad. So we've got to make sure we realize we're always talking about a 2.5 week lag. So I want to make sure, because I think a couple of people asked that question. It's really not incompatible with what we're saying. Now, with regard to what do we tell the American people, Kelly, what we've been telling them all along, that the only tool but the best tool we have is mitigation. We know it worked in other countries, and we're seeing how it's working here. So if we really want to make sure that we don't have these kinds of rebounds that we're worried about, it's mitigation, mitigation, mitigation. That's the answer.
When new cities and new states come on the chart,
Yeah,
what's the message for people in those places that have not been the focus?
it's the same thing. It's mitigation, mitigation, mitigation. In fact, is the famous vice president chart is that this is the minimal of what we should be doing. You know, everyone should be doing that. And everything on here, one way or the other, points to physical separation. Whether it's no crowds, whether it's 6 feet, whether it's staying away from theaters and restaurants or what have you.
And churches and places of worship.
Exactly, exactly.
Doctor, are you worried at all about people becoming complacent though? Are you worried, I mean, because a couple of days of this, I think people are about ready to go nuts staying in their house. And I'm just curious, are you worried at all that after, 7 days from now, people are gonna say, look, I gave it my best shot, but I gotta get out? I mean,
You know, I wouldn't say I'm worried about it because I don't think it's going to happen. I mean, from what I've seen, and I mentioned it the other day, my own experience, is that people really understand the responsibility that they have for themselves, for their family, and for the country. So this is about all of us. This isn't just about us. Because if everybody does their part, you are going to not have those kind of rebounds that we're worried about.
Dr. Fauci, how many additional asymptomatic cases do you think there are currently in the United States? There's 330,000 more confirmed cases. How many asymptomatic, given what we've learned?
You know, we don't know, and even among us, good friends that we are, we differ about that. I mean, it's somewhere between 25 and 50%. Yeah, in other words, about the people that are out there, yeah. And trust me, that is a estimate. I don't have any scientific data yet to say that. You know when we'll get the scientific data? when we get those antibody tests out there and we really know what the penetrance is. Then we can answer the questions in a scientifically sound way. Right now, we're just guessing.
Dr. Fauci, why are you not wearing a face mask?
What do you, why am I not wearing a face mask now? Okay, there are a couple of reasons. One of them is that part of the, in fact, the major reason to wear a face mask is to protect you from infecting you. I had my test yesterday and it's negative. Okay.